Hello, Communications 115. My name is Sarah Laney, and this is my lovely audience for today. Nick,
Hello.
Brendan, and Steven. I'm going to go ahead and hand over.
Should I be filming you?
Yes.
Okay.
Okay. All right, so imagine, if you will, that you are expecting a child, whether it's your first child, your 15th child, and an ultrasound right before its birth. They have determined that it does have a birth defect that will impact it for the rest of its life. What are you going to do? Today, I'd like to discuss a few options for ongoing care for anybody that is impacted with a birth defect. As an aspiring physical therapist, I'd like to have every available tool in my toolkit to make sure that people live long, comfortable lives. So today, I'd like to discuss what is hippotherapy, what ailments stand to benefit, and any additional resources for any skeptics. So hippotherapy is defined by the American Hippotherapy Association as a therapy used by physical and occupational therapists as well as speech-language pathologists to use the movement of a horse to engage the patient's sensory and cognitive systems. Hippotherapy is used in conjunction with a patient's ongoing care plan. So there are 3 different parts that you will see for hippotherapy, first being, of course, the horse. So the horse is used because a horse's movement mimics movement of walking. When you're mounted on a horse, then your pelvis is actually recreating walking. That's why they use the horse. The repetitive movement also engages the patient's motor skills. The therapists that you'll see would be physical therapists, which are addressing rehabilitation and strength. These are people that you'll usually see having issues where they were in a car accident, they're trying to re-strengthen themselves in some way. The physical therapist would be used. Occupational therapists address social skills and engaging the environment. So social skills would be using other patients in the arena or even engaging the horse itself, not necessarily a mounted practice. And then finally, speech-language pathologists. They are promoting communication. Children in an arena need to make sure that they are communicating with their physical or occupational therapist. They're encouraged to use terms like whoa or walk on to engage the horse in movement. You will also find people that are sidewalkers who are supporting the patient, whether they are an adult patient or a child patient. And then you will find people that are actually horse leaders who are working with the therapist. Both of these people are considered tools and do not engage the patient in any way. So who benefits most from hippotherapy? Studies have shown that children with Down syndrome, they'll have issues with impulse control, muscle weakness, and shorter attention spans. Hippotherapy engages cognitive communication and behavior skills, and as well as muscle engagement. Children with autism will suffer from language, sensory impairment, and processing. So just being in the arena, it will engage them in improving these skills. In children with cerebral palsy, they have mobility and posture impairment. So being mounted, they improve this skill set. Any additional resources for skeptics? The Professional Association of Therapeutic Horsemanship International is a federally recognized organization with 4,800 current certified instructors. They encourage ongoing development and education. If you ever have the time, you can visit either of these 2 centers located in Colorado. So we have the Colorado Therapeutic Riding Center and their website, as well as the Provis Ranch Therapeutic Riding Center and their website. You can go on there and visit anytime so that you can read anything additional and you can volunteer to assist. Hippotherapy is a form of therapy in its infancy. Today we reviewed what hippotherapy is, who benefits from it, and any additional resources to confirm its accreditation. Hopefully all members of my audience don't have any issues with health with themselves or with their family, but if you do, then you can always consider hippotherapy as a viable option. Thank you for your time. Have a good day. This is my audience. Thanks, Stephen.
No problem.